Well, good afternoon, everyone. On this sunny spring day. That's for you. Pick up just how you like it.
I already have one.
Oh, okay. Then we'll leave it for somebody else. This afternoon, we're picking up on our oversight and accountability section after a 1 week reprieve from that. And this afternoon, we're going to hear an update on the status of some of the changes that we made in adult protective services statute in the last biennium. Yeah, I think it was the last biennium. And we have representatives from the Department of Disabilities, Aging and Independent Living. Kind of come in quietly, that would be great. They are here with us this afternoon and appreciate it. I don't know if you have you want to have the John and Joe show, or if you want to one come up, it doesn't really matter either way. Okay, that sounds great. I know. We were referring to it affectionately last week, so welcome to put up another chair. Oh, technology issue right at the moment. I'll hold on just for a second.
It's just, I'll be doubles.
Okay,
That just might be.
okay.
See.
Proceed, yeah, okay, it's okay to have us saying it twice, better than not hearing it at all, right? Okay, so welcome, and folks, we have their copy of their presentation on our Facebook page. And welcome. We will do just a quick round of introductions because we have a new cast of characters here, and this is your first time in our committee this year. So welcome back. I'm Teresa Wood from Waterbury. I also serve Bolton, Buellscore, and Huntington.
I'm Donahue, Northfield, and also Berlin.
Good afternoon. I'm Dan Noyes. I represent Wolcott, Hyde Park, Johnson, and Belvedere.
Hi, good afternoon. Welcome. Eric McGuire, I represent Rutland City.
Brenda Steady, East Milton, Westford.
I'm Doug Bishop and I represent Colchester Chittenden 20 District.
Todd Nielsen, I represent Brandon and Fox.
My name is Don Eastis and I represent Guilford and Vernon.
And I'm Esme Cole of Hartford.
Ready to go from Bridgeport, and I also represent Middlebury, New Haven, and Woodbridge.
I read Garofano, Essex, and I also represent Essex Junction.
Lori.
All right, board state assistant.
Great.
Drake Turner, because I never met that society.
My name is Aiden Carpenter. I'm an attorney for Assassin.
Good afternoon, Rebecca Silvernoble from the Dales Commissioner's Office on Principals.
Thank you. And then go ahead and introduce yourselves, and the floor is yours.
Hello, everyone. I'm Joe Nussbaum. I'm the director of Dales Division of Licensing and Protection, which has two programs, one survey and certification, and the other one that we're here to talk about today, Adult Protective Services.
I'm John Gordon. I'm the director of the Adult Protective Services program.
Thank you. So we submitted some written comments, just a very high level overview. We thought we'd be more here as a resource to answer questions about any of this. We're really grateful for the opportunity to come and share the results thus far. Fiscal year 24 was the first full year under the new statute that passed in June of 2023 and immediately went into effect on July 1st. The new statute very much was driven by, and I think has successfully centered victims' rights in that. And one of the key, I would say probably the biggest structural change that happened in that was the creation of a bifurcated possibility to have assessments as well as investigations. So when APS receives a report now, we make a screening decision if there's an immediate need with an allegation of maltreatment against a vulnerable adult that goes to an investigation. However, if it's unclear if vulnerability is there or whether it rises to the level of maltreatment, we will open an assessment to take the place of what used to be termed a field screen, where we assess for vulnerability in those elements. And we make referrals, we look more into it. If we do see evidence of maltreatment against vulnerable adult, it will immediately switch over to an investigation. I would say that this is, and John, I don't know if you'd agree, is probably the most successful element of the new statute. When you look at the approximately 4,000 reports that APS receives a year, and you look at the last year, we actually had slightly more. The numbers are in here. It was 424 assessments to the 402 investigations. So almost an even mix, but definitely it's quickly become a very important part of the new statute in our operations. You'll also see in the written testimony, and I'm happy to expand on this, in addition to all the positive elements that have come into the new statute, there's one omission that Dale has previously testified to, and that was the omission of APS able to respond to and substantiate cases of caregiver negligence. This was sort of further identified as a gap when in May of last year, May of 2024, for the first time ever, there was a new federal rule that came out for APS for state programs to follow, which happily we were in alignment with everything in that rule. We knew what was coming. We were proactive in this new statute to address that. But the one thing that was made clear that was a gap was this inability in the state of Vermont for APS to look at caregiver negligence. And John and I actually attended a meeting at HHS headquarters with members of the Administration of Community Living. That was in August last year, just to have a dialogue and hear more about the federal rule. And in that meeting, it was made very explicitly clear that this was one element that Vermont was not in alignment with the federal rule, and the amount of federal funding that APS receives under this new rule, which amounts to about one full-time employee. It's not a ton of money, but very important to our operations. We would be at risk of losing all of that if we're not in compliance with the rule by 2028. So the reason why we don't just have a bill to get in alignment with this rule, there's been some differing views from different stakeholders on how we would best meet that rule and meet this gap in caregiver negligence investigation and services, specifically in the healthcare provider sector. There were concerns that the strained workforce there might be additionally have a chilling effect on their ability to recruit and retain employees, as well as maybe having a negative impact on the culture of safety that they've been working to foster and develop, to have individuals come forward and report issues that they identify if they know that APS might be going in and investigating. Likewise, they're one of many stakeholders. There's a lot of other stakeholder groups, advocacy groups, Disability Rights Vermont, Vermont Legal Aid, et cetera, that do recognize that there's a gap and would like to see it addressed. And then, of course, most importantly of all the groups, probably from the department's perspective, are the vulnerable adults that we serve, who are not adequately being served by APS not having the ability to look at these instances of maltreatment. So we are working, we've set up, we've had a handful of meetings so far. We have regularly monthly meetings that will continue until we are able to arrive, hopefully, at a compromised language that sort of brings everybody's concerns into consideration. Our hopes are to be able to work with the legislature on a bill next year that holds in all of that. So that's kind of where we are. And I think those are the highlights. I will make note, and there's a little bit of a miscommunication in this memo here. The annual report was submitted on January 15th. We have a new information management system that collates data for us, and we're still in the period of transitioning to that. So it wasn't able to pull all the data. So we're working on an addendum that'll come in this month. And so if you happen to see that report and there were some missing data elements, we'll have it to you in the next month or so. And I think that's it from my highlights. John, did you want to?
One of the things that I thought I'd speak to, John Gordon, again, Director of Adult Protective Services, as Joe mentioned, the biggest difference in our operations is a distinction between investigations and assessments. Probably the biggest difference from a more philosophical level is the changes of where the rights were placed. In the old statute, the reporter had more rights than the victim. With the new statute that was implemented in 23, the victim has been given more rights. And that in some ways has had on paper, it looks like a fairly small change, but it had a pretty significant change to our operations. I hear staff talk a lot more about what does the victim want? And so that's just something that I hear all the time. And we have that sort of built into parts of our decision making, specifically around assessments versus investigations. Think of the shorthand, and this is a shorthand. It seems to work pretty well, but it really much is a summary. Assessments are trying to address the problem by bringing people together, and investigations are trying to address the problem by separating people. Because ultimately, an investigation would result in potentially a registry placement or a criminal referral. And those both tend to be more punitive versus an assessment. We may be working with the person identified as the alleged perpetrator with the AV's permission and desire to try to see what services needs or reestablishment of service needs could be done to address the problem. So that's probably fundamentally the biggest change that came out of the statute, is how assessments are very much more service focused, very much more, I can say, collaborative. Part of this started with the Service Navigators, which was a program that we stood up underneath federal grant. And then we continued it. We used our experience there to form what was helped feed into the statute with the assessment side of things. So that's been the biggest fundamental difference to our program's operations. We are doing more assessments than we are investigations. But the assessments previously, even though we did way more investigations, we didn't substantiate that many investigations. And so now we've sort of eaten up a lot of those. What used to be unsubs are now handled under the auspices of an assessment.
That was going to be one of my questions, is whether or not that this change in process had resulted in a change in your substantiation rate.
It has. It's a little bit hard to see exactly what the effects are. I think that once we get because we had a couple of different changes. We had the change to the statute, and that very significantly impacted what our practice was throughout that year. And then the following year we went and we changed our information system, which I don't know if anyone's gone through an information system change. That was pretty dramatic. And we had a number of delays in processing while we stood that. Now that system's been operational for quite a while, but the reporting aspect has kind of come and gone. So I think that it, in some ways, looking at the data that we have, I think our substantiation rate is higher on a smaller number. So we have a smaller population that we're substantiating a higher percentage of. So if you're just looking at substantiations, we only call outcomes on investigation substantiations. When we're looking at assessments, we don't sub or unsub assessments.
No, I mean, I'm presuming that if you uncovered evidence that would show that it would need to move to an investigation, you would then sort of transfer the categories to investigation. So
that's why it's like we have a smaller number of investigations. We have a higher percentage of those that are substantiated. So I don't know that the substantiation numbers themselves will have changed dramatically. But the other thing is there's a lot of cases where all parties involved would say, well, this is a substantiation, but it's not going to help anything. That is an aspect where I think the assessment has been successful.
Peter, did you have a
Yeah, I
question?
just, thank you, both of you, so much for your help as we were working on this legislation. You both put a lot of work into this. It didn't go unnoticed. Could you give some examples where an assessment has helped somebody be able to care for, just some general high level examples of how some positive outcomes that have come out of having the assessment track?
Can I jump in with one that comes to mind right away without getting into specific, private information? One of the changes you might recall that we made with the statute was confining the registry to caregivers and people that work with vulnerable populations, and not substantiating for registry placement. We can still find evidence of substantiation, but just not the registry for people that don't. So what assessments have been able to do. It also, the new statute allowed for things like restorative justice and ways to facilitate reparations, lower the rate of recidivism by the alleged perpetrator and re-victimization by the vulnerable adult. So I think assessments make that much easier when you don't have, one, the threat of statutory requirement to move potentially towards registry placement, and can work with other incentives to achieve all those good results. So I think that that's one of the fundamental things that I've seen. And John, you probably have a boatload of examples, but that's a high level.
I think the most common, and this, I'll give one example, but this is more of a category rather than just an example. But we see a lot of individuals who are receiving care in the community and their caregivers are struggling. They're struggling. There's no, in some cases, they're more than struggling. So we would get a report, and a report would contain some allegation. Before we would go out there, well, what are we doing? We're doing an investigation. We're investigating to see whether this individual maltreated another vulnerable adult. Well, now, like, we know that many times these are family members that are just doing the best that they can, and they're between rocks and hard places. And so now when we go out there, if it's not clear that this is if the allegation isn't very clear, like, is this, if it's a professional role or a licensed individual or someone like that who their only relationship is a caregiver typically paid, we'll go ahead and route that to investigation. But on the assessment side, when we're opening a case as an assessment, we're not going out there with an investigative mindset. We're going out there to say, okay, what's going on and can we do anything to improve it? Which is very different than going out there to, I'm here to gather evidence for a conclusion. And so I can think of a number of cases where we were able to provide assistance and referral for the person named as the alleged perpetrator to get them the help and support they need to continue in their role as caregiver. So it's a very different, a lot of the things that you're doing under an assessment versus investigation, the same, but you're approaching them from a very different way. It's very different having an interview for the purpose of gathering evidence, the formal recommendations, as opposed to trying to understand what a person's circumstance is and how can we help them get the help that they need to continue in what they're doing. So that's, I think, that's a category. I can think of a number of specific instances. There's a case that I went out on because a staff member didn't respond within the time frame they were supposed to. We have safety checks, and so I was close, and so I went out and the staff member was working with the AP to get the alleged perpetrator, the person named as the perpetrator, to get them more support, more assistance. So it just allows us to approach much more softly, rather than assume that there's a problem here that we're going to fix with the registry. And I would say that's an entire category of cases that way.
Representative Garofano and then Representative Steady.
Thank you both so much on all your work on this piece of legislation. You talked about the service navigators, I think you called them. So I wondered if their role is kind of connected to what you just talked about as far as like identifying resources for folks on either side of the, allegations, if you will. And then also, if you can talk a little bit about your collaboration with other state agencies as far as getting people resources, if it's related to maybe substance misuse or mental health, again, on both sides, right? Like an alleged perpetrator could be struggling with some mental health issues that they could use like a referral. So are you collaborating with other state agencies to provide that support and make those connections?
Sure. So I'll start with the service navigators. So the positions that we call service navigators started with formula grants from federal government out of COVID. So they provided grants, and we looked at what do we really need. And part of what we really felt like we needed was more of a service focus, like, because what are the situations that we would get into, kind of like I was saying, I didn't really feel like putting someone on the registry is going to fix that. We needed more of a kind of a social work mindset of what's missing in the situation, how can we plug it in. So we hired these individuals, we wrote up these positions that we called service navigators. Now, we took that experience and we used that to inform some of the testimony that we gave regarding the assessments. So what we're doing in assessments from a procedural protocol standpoint very much is what we developed using service navigators under the grants. Now, we still have some of those positions. The federal funding is winding down, and we'll have to see what happens with Social Security block grant moving forward, because we've intended to use some of that funds moving forward. We'll see if there still is social service block grant. So we still have some of those positions. And we also have some staff that their title is investigator, but they do assessments, and they, in one case, started out as under the title of service navigator. So that function really has become what we do in assessments. So while they'll be gathering information, they're not guilt seeking when they're gathering the information. So that's kind of a fundamental difference as well. They're not looking for was their fault here, or gathering evidence. It's more of we're trying to figure out the situation so we can figure out how to help it. And if we find more information on maltreatment, then kick it over to investigation. So that's really how that part has been incorporated now, regardless of what role, what title the staff person's carrying. When it comes to other collaboration with other entities, we collaborate. We work directly with quite a few other entities, and we make referrals on a daily basis to other entities, whether they're state programs or nonprofits, or area agencies on aging, or private first name basis with quite a few of those, for shelter and food assistance through mental health, substance abuse. We have we're making referrals on all those cases, which is a primary function with the assessment.
So steady.
Where do you get your referrals? Are they private? Are they agencies? How do you know who to reach out to? Like, where do they come in from?
Oh, our report.
The reports to APS?
Yes.
So in the statute, we do have mandatory reporters, which anybody that works in any capacity with vulnerable adults is required to report if they don't need to even necessarily believe that there's maltreatment, but if they suspect that there might be, and that this individual that's an alleged victim is vulnerable, those are the only two criteria that need to be met. They're required to report to us, and there's a number of ways. The most common is online reporting. But anybody in Vermont or anywhere can report to APS. You don't have to be a mandatory reporter. And we are on track this year to crest about 4,000 reports, of which roughly about a quarter get screened in for either an assessment or an investigation.
So how would somebody know about APS? Like, how would they know?
Hopefully, well, we do offer training, mandatory reporter training. And we encourage, actively will reach out to partners and offer that on a regularly, I think a monthly basis. And we've also done some awareness campaigns, especially during COVID. We really elevated that because a lot of people were experiencing isolation. So we wanted to elevate the awareness. So we were doing radio ads and print ads.
Nice. Okay.
A lot of that.
I have a lot of my hometown that reach out to me for everything.
Yeah.
So this is new. Awesome. I didn't know about this one. Now I have a new one.
Mhm. Yeah.
Thank you.
Great. Wonderful.
Thank you.
A lot of our reports nowadays has been scams. Feels like we're swimming in scams. So a lot of our response has been on responding to individuals who have been scammed, trying to. A lot of times, unfortunately, we can do if it's a out of country scam and the money's already been extricated and converted into crypto and it's gone. But we do a lot of sometimes I think that just somebody knocking on the door, talking to them about the decisions they're making after their bank gives us a call. So that's one of our report sources. We get reports from banks and financial institutions. A lot of the nonprofits that we work with, obviously, they report to us, but anyone can make a report.
Yeah, go ahead, Dan.
Just real quick, so during when we were putting this legislation together, we did have a lot of discussion around banks interacting with the department and being able to report. How do you feel that's going?
Wonderfully. You may recall last year, John and I provided testimony. There was actually something written into the statute that was sort of a conditionally, we were going to be coming back to talk specifically about banking. We did draft and implement a user agreement. We can't call it an MOU, but it's essentially an MOU. And that is now signed and in place. And everyone universally that was involved in that effort was behind it, from the Bankers Association and the state, and going back to our state partners, the Medicaid fraud, it's been very positive. And I think, as one of our biggest challenges is always awareness, just elevating the awareness around it. But it's benefited everybody.
Yeah, the one exception I would say is the national banks tend to be much more difficult. The smaller banks, as a rule, like the smaller the bank, the easier they're to deal with. And also the more sort of agreeable they are when we go and show our credentials and whatnot. The Bankers Association, they've worked with us really well, and we've kind of worked out a vetting process with them. So when their banks have questions, they have a route to go and ask them, so that they can quickly vet our people so they know that it's legitimate.
Does that include credit unions, John?
It doesn't, but I would say the credit unions have generally been pretty easy to work with. But when you're talking about like the Wells Fargo and the Chase, those entities, those are where we really, we will get reports from them, but getting any other information from them is difficult. If you get we may get a report from a fraud officer in Timbuktu, and that's probably the last communication we're going to be able to establish with that large national bank.
In your report, you were talking about that there were 44 individuals placed on the registry, which seemed relatively consistent over the last 3 years. I'm just wondering, what's the decision point between, and you obviously had a lot more investigations open than that, and I'm not sure how many were substantiated, but what's the deciding factor about putting somebody on the registry versus substantiating but not putting them on the registry?
So there's not really a deciding point, other than the registries currently is, since the new statute is configured as a caregiver registry. So if the individual doesn't meet the definition of a caregiver, then we would not recommend they be placed on the registry. So that, as much of a deciding point, it's really that would be about the only thing. We don't go and say, well, this person is a caregiver, but if they meet the definition of a caregiver and you substantiate them, that's what we're going to be recommending.
And so Representative Payee wouldn't necessarily meet the definition of a caregiver?
By our interpretation, it would.
It would.
It would.
Oh, okay. All right.
POA, if they have an active POA,
Yeah.
that's
POA.
power of attorney, payee, guardian, of course. But part of the formulation that we would do in our summary report would be, are they a caregiver? If so, how are they a caregiver? Way, because if they're being paid to provide care, then that's pretty easy. If there's a formal document signed, that's fairly straightforward. But then you get into the more murky areas of which are quite common. Person provided care, but it's not formally established. So that's where that analysis is done.
Thank you.
And I'll add to that, one assumption that people make, that's often made, I should say, is proximity. For example, well, this person's a family member. That means they're a caregiver. They may be a family member and they provide care, but unless we can show that they formally accepted that role, we're not going to use proximity alone insurance to say that they're a caregiver.
The other thing that I noticed is that you don't receive a huge number of expungement requests. And I can't recall, to be honest with you, if we amended how expungement can happen in the statute, or not. No, okay. So I'm just trying to figure out if you got 11 requests and 5 resulted in expungement and removal from the registry, then how were 11 requests denied? I didn't understand that.
You repeat those numbers?
Yeah, it says, in fiscal year 24, the department received 11 expungement requests. Of these 11 requests, 5 resulted in expungement and removal from the registry, and 11 requests were denied.
It sounds like a typo.
Yeah. We've got that addendum coming, so we'll definitely capture that.
Okay, maybe there were more requests and
No,
Or less.
or less were denied.
Yeah.
Yeah, one or the other. Okay. Other questions for the witnesses? Here's your chance to learn anything you want to know about Adult Protective Services. Yeah, go ahead, Doug.
What is the size of your staff and roughly how many people are engaged in the assessments or investigations?
Sure. So currently we have 16 permanent staff. We also have 4 staff who are limited service positions, grant funded. Of those 14, so that would be 20 total, 14 of those are field staff. So those are the ones, and I may be off by 1 because we have half positions are field supervisors or half supervisor, half field. And then we have 4 individuals who pretty much do assessments only. We have 3 field staff who do investigations only. And then the ones in between do a mix of investigations and assessments. Probably 2/3 assessments, 1/3 investigations.
I'm just thinking, as you're thinking about what is, changes that you'll be bringing next year potentially. You might think about the reporting requirements and an update to those and whether or not we should be changing elements of those reporting requirements. Kind of on first blush, I would say we should be. Not sure how relevant some of it is at this point in time. And I recognize, previous body put them into place for a specific reason because there was issues around substantiation, feelings like they were insufficient substantiations or whatever at one point in time, and timeliness and all that stuff. But so I would just encourage you to take a look at that and maybe propose something that might make a little bit more sense.
Thank you. I believe it or not, we, in a draft of our testimony, we went into that and we decided it might be premature and may not be the place of the department to say that, but at your invitation, we will.
We're thinking along the same lines.
Yeah.
That would be good.
We'll certainly work on it.
Okay. Any other questions that people might have? Thank you very much for the work that you're doing, and we look forward to working with you again next year when you have some updates for us. And I do recall the healthcare industry being very concerned about the changes at one point in time, and we modified some language. And I'm not sure we ended up with exactly what everybody wanted, but I guess if nobody's satisfied, then I guess that's a good compromise, maybe. I'm not sure. But I suspect that we'll have similar concerns as we go through the changes that are, looking at trying to comply with the federal rules. So, to the extent that you're able to do some pre-work on that, and it looks like you're, involving the folks that you need to involve, and that would be really helpful. And then I'm just recalling fondly or not so fondly, I just recall it's just like, yeah, this is a very collaborative process and everybody's in agreement and all these things. And of course, then they all weren't in agreement. So as we worked through what I thought was going to be a simpler bill for our first committee, foray into that. And so whatever we can work out in advance of being here is great. But still, if there's things left for us to work out and make some decisions on, that's fine too. But I appreciate your involving people in the process of making some further revisions to the statute. Because it makes things go a lot smoother if we can have some agreement, or honestly, pointing to the areas where there's disagreement and not being able to reach agreement. And that sort of leaves us at the point of understanding, what people's issues are. So you don't always have to come with things that are all wrapped up in a nice little package. If there's things that people can't agree to, we'll figure it out, So.
Thank you. I know it's Dale's position to do everything we can to broker, which is why we actually put a pause on this year. We want to find that agreement and bring that. I'm also very mindful, as I sort of alluded to earlier, the population that we serve, which sometimes has the quietest voice because we exist, because they struggle with engaging in many cases with services. And I'll sort of flag the individual that came to give testimony in 2023, who was a vulnerable adult. And I think that was a big motivator for a lot of people hearing about APS for the first time. That was a victim of caregiver negligence. So it's something that we do see as a gap that needs to be addressed. And as I said, we will work to find a solution that hopefully everybody may be a little bit dissatisfied, but taking everything into consideration and something that's workable.
Thank you. Thank you. Any other questions for folks? All right. Thank you both for being here this afternoon. I guess it's afternoon now. Thanks very much. We appreciate it. And look forward to seeing whatever you come up with for next year.
Thank you very much.
Okay. All right, folks. There's some extra those. Yeah, if you can you pass them along. Okay.
Did you get one, Tom?
So we're moving on to H91 and so I worked with Katie over the weekend to take into consideration the feedback that we've received. I know we have continued to receive feedback today, mostly from the shelter community, and they of course hadn't seen this revised version. Doesn't mean that they're going to be in any more agreement, but the revised version takes into consideration, I think, a lot of what their concerns have been. So we have Katie coming at 2. So what I'm going to suggest, because this is the first time that you all are seeing it, I'm going to suggest, Lori, that we go offline and that people take the next 15, 20 minutes just to read through this draft so that when Katie comes, we can talk about further changes. We will not be going page by page through the input that we've received. I've done that, incorporated a lot of the suggestions, and we had actually already worked on some of the stuff that got incorporated into this draft. So just wanted you to know where we're at sort of in the process. We'll be looking at the actual language. We'll be taking into consideration any additional edits that people may have or questions that they may have, and we'll be working from that. Yeah, Todd.
I'd like to say something
Yeah, sure.
in reference to H91. I would like to set time limits on hotel and motel use as temporary emergency shelter, 90 days max. No hotel and motel use for transitional shelter. Also, we set a date when hotel motel program is to be used right now until the end, July 1st, 2027. Can use hotels and motels by renting part of them at a much less price. In financial year 2026 one-time funding. I got 10 minutes, I think the number's wrong. Should be used to establish shelter or housing and gradually get rid of hotel and motel per room use by fiscal 2027. Also, I support Eric McGuire's proposition that engagement and responsibility should be on both parties. Thank you.
Okay, thank you. Okay, so